We all go through periods where we don't feel well. When this happens, there are 4 critical areas that need to be looked at in a systematic fashion. The first is vital signs. This can be done on a regular basis in one's home. Height, weight, temperature, blood pressure, respiratory rate, pulse rate, and pulse oximetry for the percentage saturation of oxygen in the blood. It's a good idea to weigh yourself every morning after waking up, going to the bathroom before you've had anything to eat. If you have unexpected weight gain or weight loss, that may be evidence of an underlying medical condition that needs to be addressed. For example, unexpected weight gain due to slow thyroid function, or unexpected weight loss due to new onset diabetes mellitus, for example. Temperature can be done every morning also. If you're not feeling well and you have a temperature of 100.7 Fahrenheit due to some underlying viral syndrome or bacterial syndrome, you're not going to feel well. A home blood pressure kit can be very helpful. You're not feeling well and you're running a base blood pressure of 160 over 100. You're not going to feel well until that issue gets addressed. Respiratory rate. If you have an elevated respiratory rate due to an underlying lower respiratory infection or other medical condition, you're not going to feel well. If your resting heart rate is over 100 beats per minute due to an underlying medical condition such as an illness, atrial fibrillation, severe anemia, you're not going to feel well. You can certainly purchase an inexpensive pulse ox machine that goes right on your finger to check the percentage oxygenation. If it's low, perhaps there's an underlying lower respiratory infection or blood clot in the lungs, etc., anemia. The second component when you don't feel well is a thorough physical examination by your trusted medical provider. For example, you may have trouble breathing through your nose when you train. The medical provider evaluates you and says you have evidence of nasal polyps in your right nostril, blocking airflow, or evidence of uncontrolled allergic rhinitis, allergies that need to be addressed. Or you feel neck pressure and your medical provider diagnoses you with a goiter, an enlarged thyroid gland which is pushing on your windpipe. That can contribute to you feeling unwell. The provider listens to your heart and hears new onset atrial fibrillation or some other irregular rhythm of the heart, or listens to your lungs and hears evidence of a lower respiratory tract infection or uncontrolled reactive airway disease, asthma. That can contribute to you feeling unwell. The third component when you're unwell is laboratory and imaging testing. For example, a complete blood count looks for evidence of anemia, leukemia, an undiagnosed viral or bacterial infection. Comprehensive metabolic panel can look for evidence of prediabetes or diabetes mellitus, abnormal electrolytes, liver kidney dysfunction, etc. A TSH will evaluate one measure of your metabolism, the thyroid function. If your thyroid gland is running too slowly or surprisingly too quickly, you can feel unwell. If you're suffering from muscle aches, joint aches, perhaps an ANA to look for lupus, or a rheumatoid factor looking for rheumatoid arthritis or other autoimmune syndromes, or a SED rate, a nonspecific marker of inflammation, may be helpful. The fourth component is going to sound like it's coming out of left field, but I've been doing this a long time and I can tell you for a fact that there are several over-the-counter and prescription medications that have significant side effects that can include fatigue, dizziness, weight gain, muscle aches, joint aches. It's always important to do a thorough medication review of all over-the-counter medications, herbal supplements, and prescription meds that you are taking. For example, over-the-counter sleeping pills can contribute to daytime fatigue, dizziness, feeling unwell, weight gain. Over-the-counter allergy medications have similar side effects. Some herbal supplements can contribute to muscle aches, joint aches, and there are several more. On the prescription side, again, prescription sleeping pills, allergy pills, blood pressure medications can trigger muscle aches, joint aches, fatigue. Medications given to lower cholesterol are notorious for causing muscle aches and joint aches in patients. Psychiatric medications can cause weight gain, fatigue, sedation, muscle aches, joint aches. You can easily go online and type in the name of the medication that you are on and find the side effects. And I would be remiss if I didn't say that many times 2 or more medications taken together can amplify each other's side effects, where if you were just on one medication, perhaps the side effects would have been minimal or non-existent, but being on 2 or 3 together pushes it over the threshold for side effects. So if you are feeling unwell, always think about vital signs, a physical exam from a provider, labs and imaging if needed, and a thorough medication review. And vital signs and medication review can be done on a regular basis at home with simple equipment. Be well always.